right, guys. Hi, everybody. We're gonna get ready to start here. So just to introduce ourselves, my name is Cam. Have been with Ultherapy for the last 2 years, living, breathing, eating Ultherapy every single day, 5 days a week, and sometimes more with the weekend events and things like that. But I've had the pleasure of working with Jill for the last 2 years. I've been able to learn a lot from Jill because she's been doing this since the beginning, literally, since Ultherapy came out on the market. She's been doing Ultherapy. So I was able to kickstart a lot of my learning through Jill and really grasp a lot of different concepts and how Ultherapy's evolved and changed throughout the years. But that takes us to introducing Jill. So Jill's been doing this for a long time, guys. I mean, I think it's been like 12 years that she's had Ultherapy. She's worked through some of all the different protocols that we've had. She's helped even, we've even asked her throughout the years on her experience, and she's been a big contributor at that. The big thing I will say with Ultherapy is the provider matters. So I'll let Jill just kind of talk to you about her experience throughout the years, and maybe just kind of go through what that's looked like, and then we'll jump into the presentation. So.
Yes. Okay. So I have been with the Parker Clinic now for 5 years. I was with Dr. Goldman for 16. We were at university hospitals and then independent. And strangely enough, Dr. Parker and Dr. Goldman bought their machine the same week. At that time, I did work for Dr. Goldman. And what Cam is explaining is that this has kind of evolved into changing the protocols, making them better via, before and after photos, just following through with their departments on tracking all across the country how these treatments have trended and the patient positivity rate and things like that. So we're going to explain a little bit about what Ultherapy is, who's the right candidate for it. You can type in the question and answer area, yes, if you would like a phone call back. We'll have the front desk call you. They can schedule you an in-person, obviously, interview, with me to see how you're feeling about it, what you learned. These types of, we're going to have some sales on the treatment, and we'll let you know like what areas are good for you and things like that in person. But we'll also, divide up the face for you a little bit and let you understand what areas we treat and why we think this is such a good treatment for pretty much most everyone across the board. It really adds a lot of extra tightening and lifting and collagen remodeling to what you're doing on a very deep level that tends to last and stay, which is great. It's not injected, your body's not absorbing it, it's your own tissue. So we think that that's a really good thing to have done. And it couples extremely well with lasers, Botox, filler, and all of those types of treatments because it's on a deeper level. So we're going to get into that a little bit more and let you kind of understand it. And then we can start answering some questions. The biggest thing is I need you to type your name and yes, if you would like a call back, because my front desk is going to be working on calling and scheduling patients and making sure that you either get an appointment booked to have the treatment done or at least a consultation. These specials will be running through the end of December.
Okay. So here, we're just going to start off by introducing Ultherapy with a little short video. It's about 2 minutes long. And again, if you're tuning in from work and you have a lunch break or something, we should be done by 12:30. So no worries there, but let me just get that going.
With age, skin loses its elasticity, and the signs of aging become more visible. Beneath the skin's surface, structural proteins such as collagen and elastin fibers stiffen over time. This leads to a decrease in skin's elasticity and contributes to the sagging and the forming of wrinkles. Ultherapy is the natural choice for a non-surgical way to lift and tighten skin using safe, time-tested ultrasound technology and is backed by 4 unique FDA indications and research from over 50 clinical trials. Using micro-focused ultrasound, along with its proprietary deep-sea ultrasound visualization, Ultherapy delivers energy to where it will be most beneficial, leading to a lift of the neck, chin, and brow, and can also improve wrinkles on the décolletage. Ultherapy reaches the same deep tissue layer as surgical facelift addresses, but without surgery or downtime. During an Ultherapy treatment, ultrasound waves are micro-focused at the precise depths in the dermal and subcutaneous tissue, sparing the skin's surface and intervening tissue. Friction heats the tissue to between 60 and 70 degrees Celsius, forming thermal coagulation points at depths of 1.5, 3, or 4.5 millimeters. Delivery of ultrasound energy in this manner causes contraction and denaturation of collagen and initiates the body's healing response, resulting in collagen synthesis and tissue repair. This new collagen growth leads to natural-looking results that accumulate gradually over the course of 2 to 3 months, with visible improvements that can even be seen a year after treatment. Ultherapy is the first and only FDA-cleared procedure to non-invasively lift the eyebrow, neck, and under the chin, and is also FDA-cleared for improving lines and wrinkles on the chest.
This is the presentation that we're going to be doing it today. So this is an introduction to Ultherapy, and we're just going to go through it. And if you guys have any questions, then just let us know. But just an overview. So the secret to aging, if I always tell Jill, if there is a fountain of youth outside, it would be flowing with collagen. Okay, so that's the secret. As we age, we stop producing collagen in our early 20s, and that's really your bank. That's really your bank that you're going to have for really like the rest of your life, unless we do something about it. Collagen really only gets stimulated, or we only produce new collagen after our 20s, and we stop that, that new collagen growth naturally, is if you get hurt, if you break a bone, if you injure yourself, if you have a cut, your body will be stimulated to replace the collagen that was affected. So that's the big thing. So it's really the natural thing that occurs in the body, and as we age, collagen breaks down, and that's what results in a loss of skin, maybe looser skin, or loss of volume, or even just overall skin quality. Okay. Some of the top things that affect aging is really sun exposure, lifestyle. Okay, so our drinking or smoking or whatever on the weekends, stress, which is a big one, and time. Right. So just the aging process. So as we go here, the biggest signs of aging, at least when it comes to Ultherapy, the underlying changes really revolve around a decline in collagen production. So again, that fountain of youth, as that fountain starts to drain, we start to age a little bit, as you can see the progression here with the patient here. So the collagen that we do have also weakens over time, and we also get a loss of elasticity. So if anyone has a newborn or grandbabies at home, go ahead and pinch their cheeks and see how fast those cheeks bounce back and how they kind of resist the force that we put on it. That's really where elastin comes into play and what keeps everything nice and tight and in place, so to speak. And so when we get a decline in collagen and elastin, that's where we start to see some of the aging factors and some of the loose skin kind of come into play. Some of the visible changes from loose skin or weakened collagen fibers really lines and wrinkles. That's kind of like the world, at least me and Jill live in, of course. And probably why a lot of you are tuning in today. But a big one is the cheek droop. So we kind of just get a loss of fat.
Bottom, and up at the top.
Yep. So the cheek droop, and it kind of hangs out maybe towards the lower part of your face. And then we get the eye hooding, which is a big one. I mean, that's a big one that affects really almost everybody. The sagging neck is a big one, and then jowl formation is something that we hear most commonly. But Ultherapy lifts the skin by building collagen. So with Ultherapy, we're not injecting collagen into you. We're not, all we're really doing is using heat to break down old or weakened collagen fibers. And as you can see the progression here, when your body replaces that injured collagen or that destroyed collagen that we did with the heat from Ultherapy, what results in is the bottom picture here is a nice tighter network of collagen that's really new collagen that helps create a smoother surface, okay, decreasing the wrinkles and taking care of some of the sagginess that we might have experienced throughout time. So here, Ultherapy, I believe in it so much. That's why I'm here in front of you guys. That's why me and Jill have had such a successful partnership in 2 years. It's considered the gold standard for non-surgical lifting and skin tightening. Okay, so when it comes to choosing what you're going to do to address some of the signs of aging, the loose skin or some of the sagginess, which is not so nice of a word, it comes to what are your options? Ultherapy is the only FDA cleared device for that has a lifting indication.
Yes.
It also
Which is
has
a
a
huge difference.
correct.
Huge.
An FDA clearance means they're designed to protect consumers. So they gave us the seal of approval that yes, we do lift when someone gets treated with this, and it is super safe. The only other option really that you have for lifting is going under the knife, whether that's a mini facelift or a surgical facelift, things like that. So if you're not a candidate or you don't see yourself having a surgical facelift, or you don't have enough skin or loose skin, so to speak, to get a surgical facelift, Ultherapy is your only option, and it works.
Yes.
Okay.
And it's doing it by your own tissue, which is also, yes, you can get a little bit of lifting from fillers, but this is your own tissue that is remodeling and tightening and doing the lifting.
Yeah.
It's a big one.
Yep. And then so this is kind of, in the time of political campaigns that we're all sick of by this point, this is almost like a little slogan that we have, like how to tighten your skin without surgery, Ultherapy, that's how. And then so here, the big thing is with Ultherapy, we're able to see exactly where we're treating.
Yes.
So that's huge. Any other laser or device on the market, you're just going in blind and you're kind of just following the protocol based off what was designed for our prototypical patient. With Ultherapy, we're able to see exactly where your tissue is. So that's why every single area that we go over and every single person, it's going to be a customized treatment that Jill uses what you see on the screen, the ultrasound imaging, like you would if you had to visualize a baby in the womb. Mm-hmm. It's giving us the same feedback to identify where the really nice collagen is that we're going to break down and you have your body replace. Okay. Yes. So these images right here, that's actually what Jill was looking at during the treatment to choose the best way to treat every single one of you that are in attendance today. Okay. Now, here's another slogan for you. Okay, so it's very scientifically based, and so to boost your collagen. Okay, we have tons of studies on it. We won't even get into that right now, but the big thing here is that Ultherapy uses. It's not a laser, so to speak, but you could think of it almost like a laser. Mm-hmm. Lasers use light to deliver heat. Okay, Ultherapy uses ultrasound to deliver heat instead. What does that mean? Lasers are really, 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 really good for the surface of the skin. Think textures, mm-hmm. think microneedling.
Can you move this? Like this area here is what this is showing you here. Okay.
Yep. So when it comes to lasers, we're using light-based therapy. That means the energy enters from the surface of the skin, and it's really, really good for like the first layer of the skin to improve the texture, to improve the pore size. Where Ultherapy differs is we use ultrasound heat and we bypass the surface of the skin, so we don't actually affect anything on the surface of the skin. We actually we only deliver the heat at the predetermined depths of 1.5 millimeters, as you see there, mm-hmm. of 3 millimeters, as you see next, and then all the way down to 4.5 millimeters, which is a similar depth that most plastic surgeons will get to during a surgical facelift.
And that varies per patient. That's what he was talking about. When you saw those ultrasound looking images, we're looking at each patient to see, and it can vary from under your chin, on your right cheek, your left cheek, your forehead, all of those areas can have different areas that would involve a change in the depth that we pick for each patient. And that's why this is so different. So the first pass then would be at your 3.0 millimeter or 4.5. And what I think is also very significant, and a lot of people ask me about radio frequency, here you're seeing the radio frequency patient is just getting heated to this level. They're not going below. So the first pass that we would do on you as an Ultherapy patient is determined here in this level. And what's so important is that we follow it with another one. The two of them work together and really give you what I believe is a much better outcome long-term. And it's all your own tissue. And whatever we tighten stays, it is permanent. It doesn't go away. Your body continues to age at the age that you are. So that is what is so different, I feel, between that and other modalities that we carry.
For sure. Now here, this is kind of what Jill's referring to. We're starting your own body's collagen. That's super important. We're not going to change how you look.
Right.
A lot of times, and me and Jill have talked about this, we tell people to bring in a picture of themselves from maybe 5 to 7 years ago. That's what we expect your results to be. We don't expect you to come in here looking one way and come here, leave here looking like a Kardashian, so to speak.
Right.
Okay?
No.
We're not injecting anything into you. We're literally just using your body's own collagen and your body's just going to rebuild it. That's the trick. Okay. Now here, we're using, just for people that say, how does ultrasound, I had ultrasounds done when I was pregnant. How does that deliver heat? Here's how. So first we do collimated ultrasound, where all the sound waves are traveling in the same direction. That's what you had if you're, to visualize a baby in a womb or medical ultrasound. When we press the little button on the hand device, the ultrasound waves travel and they actually hit each other. So the ultrasound waves hit each other. That friction is what provides the heat. Okay, so we're not a laser. Laser uses light to deliver that energy. We're ultrasound, and the waves just hit each other. That friction delivers the heat. Okay, that's it. That's the secret. Okay. Now here again, your fancy slogan. Okay. But here is, we're just, we've referenced this a couple different times, so we're not going to beat a dead horse here, but we're just letting your skin do the work.
Yes.
As you can see from the pictures here, we didn't change how these people looked. We just took away some of the signs of aging. On the top picture, really identify under the chin here and the jawline, how we were able to kind of just add that contour to the jawline.
Yes.
And reduce the skin issue that, Zoom has been a great tool in pointing this out when we're kind of zooming from down here, and taking care of like the loose skin and, kind of reducing the appearance of fat under the skin, that turkey neck area. This patient below, that's what we would determine as advanced laxity, which, this patient might have been a surgical candidate at some point, but she just didn't want surgery, So for whatever reason, whether it's the cost or the downtime, the recovery, whatever the case may be, if you're not a surgical patient, this is, an expected result. That's very, you can see just how we reduce some of that turkey neck, under the chin, and then highlighted again that jawline, reduce some of the aging in the nasolabial fold and in the lines kind of like in the cheek droop on the face. And then just like overall skin quality just looks to be great.
And when it relates to her, I would say too, like, you would then maybe see Dr. Parker for under eye filler, something of that nature. You could also do some filling in through here. But when your body is doing its own regenerating in this area and doing some of the lifting and pulling back, you're not expecting fillers to do all of the work on its own. Most of the therapies are blended together. She could also do a nice youthful lip and things like that would help her.
Yep. Now here is the areas, okay? We're able to customize Ultherapy exactly how you guys want it. So some people, the best thing to do is to have everything lift together. We don't want to lift one area and leave the other area hanging.
Untreated.
No pun intended really on that. So it's really, we could customize, we could just get brows done if we really wanted to. But the most, I guess the most popular treatment that we have is people that get the full face done. Okay. Yes. So full face addresses all of the areas you have here, all the way down to under your chin. So if you kind of run your finger down, it's where my Adam's apple is basically, is where you would stop on a full face. So we would address the under the chin area.
Submental, cheeks, around your mouth, under eyes, out on the edge of your temple, and raise your brow. That's considered full face. And it's a very nice treatment for your face.
Yep. And if your budget allows it, and you do have some areas of concern on the lower neck, we do every area that Jill just mentioned all the way down to here. And then we just include all the way down to your collarbone. Okay. So it's really important that we could customize this exactly how you want. You'll see the packages towards the end of this that are going to really highlight that, what specials we have going on. And then here are just some before and afters that, we're kind of
hooding for eyes. Yeah, we're getting towards we're
crunching on time, but you could see just like the hooding on the eyes, like that first picture on the top left. Just as a great example of exactly what we're able to do with Ultherapy. And then this is just an example of what we can do for like under the chin. So really like those pockets and like that loose, everything kind of ends up bunching up under the chin and the submental area a lot of times. And really just right now, jawline is in. So like we want to highlight your natural bone structure and your natural contour of your face. And that's where Ultherapy really comes in. Yes. We get rid of the skin that was kind of hiding some of our nice features that we had. And then this is where the neck comes in. Okay, so this is some of the wrinkling and some of the bunching of the skin that we have under there. The vertical lines, we actually term that tech neck, technology neck, where people are just always looking down at their phones or computers or their WebEx screen, and we address those lines. Okay, so patients are starting to get younger and younger that develop these. So we're able to help with that.
And they're also necks are difficult to treat historically. So to be able to use this treatment, you can be outside. Of course, we want you to wear sunscreen, but you can be in the sun, you can have a tan, you can be African American, any type of ethnicity is fine. It's safe, won't cause problems. I have not seen darkening. You could get a bruise once in a while. That's more under the eye that I've noticed more than the neck. So it's safe, which is great. And also helps the décolleté, which is wonderful.
Yep.
A lot of times if you notice that you have more wrinkling in the morning when you've slept on your side or something like that, it's really going to do those V lines that we end up having kind of down in this area on most patients that sort of tend to go this direction. And when we treat, we're kind of doing this area here. So it sort of spans, oops, sorry about that. It spans out. So it'll be out to the edges of the décolleté area. Part of the pricing too is if you do full face and neck, you get your décolleté free. So that's a nice treatment. There's some of the lines that I was describing there on the bottom that I see a lot that people come in. It just bothers them. Sometimes you notice it more in the morning than when you stood up a while and things like that. You don't notice it quite as much. But this is a great time of year to be able to do it too, because you aren't getting sun and you can kind of track what's going on. So.
Yep. And so the big thing I really want to emphasize is we're not changing how you look. We're really just like, you can see here, we're not moving mountains. You're not going to leave here and in a week, people are going to ask you, oh, what work did you have done? It's a really subtle, gradual change where the biggest effect and the biggest results come 3 to 6 months after your treatment.
Yes.
Okay. So a lot of people see results right when they leave. Okay. There's going to be an immediate effect, but the biggest result, because we're having your body build new collagen cells, it's going to have its biggest effect 3 to 6, 3 months, and then continue to improve all the way up until 6 months.
The healing response. Mm-hmm.
Yeah. And so this is kind of what it looks like as the treatment. We're going to kind of skip over that because if you guys are interested, Jill will kind of talk to you on the phone about what to expect and things like that. And then this is what we were talking about, immediate. Some of the side effects that you're going to see, most people get a little bit of redness, a little bit of, swelling a little bit. A lot of people, by the time they check out and get in their car, a lot of that's gone down.
Yeah.
And by the time they get home, a lot of that's gone down. I would say maybe about 10 to 20% of patients get some slight bruising. That's, just like a little bit of yellow bruising in the cheeks. But the good thing with Ultherapy is we do not break the surface of the skin. So you could cover it up. You can conceal it with makeup. Very or, you could put them, right now we have masks to kind of disguise a lot of that too. So it's a little nice. And so here we have redness, minor swelling. So
it's really touted as no downtime here at our practice. I mean, you will get, some people can get some, it depends on your medications, blood thinners, some of the things that people sometimes take vitamin wise can make you bruise a little bit more. The biggest thing you're not allowed to do is ice, because we don't want to change the temperature of your tissue. We want to let it naturally change.
And the big reason for that, the first stage of healing, we're causing an injury with this heat technically to your collagen network. So we don't want to prevent the first stage of healing, which is the inflammation stage.
Right.
So we actually want inflammation.
Right. A lot of times with fillers and things like that, he's saying you would do Benadryl or Zyrtec. We don't have you do that with this treatment. We let you just have a light little bit of swelling, and that's good. Yeah.
Okay. So here that we discussed a lot of the potential side effects, but that's it. There's not. Ultherapy is super, super safe, and we actually have 0 incidences of any injuries that needed any other intervention other than time.
Right.
Okay. So nothing's going to happen that's going to need surgery or something crazy. It's super, super safe profile, and Jill's never had that in her 10, 12 years of doing this.
No,
so
it's great.
Here's some safety guidelines. So make sure, we'll kind of vet this out when we call you to make sure that none of these things, the big thing is active implants. Like we don't want to treat over any metal plates or anything like that. Or, if you're pregnant, maybe we'll put this off for 6 to 9 months until you have your baby and you're done breastfeeding and things like that.
And if you are a post facelift patient, this is a really nice choice. If you've had it and you're like, gosh, I just don't want to go through that again, this will actually help you a little bit as well to kind of add to the fillers and things. It's very nice.
And help maintain your results. Even if you just had it a couple years ago, Ultherapy really helps maintain your results to just make it last longer. It's almost like an insurance policy at a fraction of the price. So here we're just going to go down, and this is the big one. So we're done the presentation. This is the special pricing that we mentioned earlier.
Mhm.
So Jill, I don't know if you
Yeah,
want.
I can. So full neck, they do vary a little bit. It's going to depend on a larger patient, a tinier little patient. There's people that we do customize it. So that's part of it. You know, when I'm doing some of the scanning and things like that. So full face is usually anywhere from 32 to 3,500. Necks are usually around 1,600 is pretty standard. And that would be basically underneath your chin and down. So it's about 3 rows back on each side, because as the areas tighten, they'll pull the neck back, which helps that front. If the jowling or under the chin is what's bothering you, you're going to want to do that lower face area. That's anywhere from 2,900, somewhere in that range. Depends if you'd like under the eyes and around the mouth, things like that. So you don't have to stick to these necessarily completely if there's things that you don't think you need, or if you've had it. The best one is actually option 1, which some people have already switched into and started doing, which is full face and neck, and then you get your décolleté free. So that's around $1,100 worth of Ultherapy free. If you're someone that feels like this is really bothering you or your neck is really bothering you, I do allow you to take the lines that I would have done on your chest and put them in other areas to customize it the way you want, which is all things that we can talk about. The other thing I want to touch on really quickly is we do recommend pain medication. Usually I just use Pronox. It works very well, especially with a nose clip, which is, they usually use at the dentist.
It's just a laughing gas, which is actually less serious than the dentist. So
right, it's very easy. Yeah, you can drive after about 20 minutes. When the procedure is over, there's no problem. If you're someone that says, I have a higher pain tolerance, I have a driver, I don't want to deal with it, we have Demerol shots, we have Valium, and we have Vicodin, and the doctors talk to you about that. They all take care of you. When it comes to any of the medications, you'll see them. So those are options. With those options, you need your driver. Driver can be in the room. It's okay with me. Or they can wait and come back and pick you up. So that's really, all I can think of. The other one, the other option is neck and under your chin. So some people recently may have done their face with me. I've got people that do this once a year. And I was trying to kind of do it for everyone. For new patients that have never done it, I would suggest full face and neck. If other people have done it and they've already done their face recently, maybe they just want to do from their chin down. So they would kind of do chin down and get under eye free. Again, you could move that to maybe upper lip. I would just take the amount of lines that we were doing and shift it to an appropriate place based on what your needs are. So I'm going to go ahead and let the front desk people are going to reach out to some of you guys and just see, if you need a consultation further to sit in front of me. We can do it via FaceTime if that makes life easier, or they can book you an appointment that way. That pretty much needs an iPhone. It's the easiest way, or just your computer if you can do it. And then otherwise you can schedule and come in and we can talk about some of those things here if you'd like. The biggest one that we need to know ahead of time is going to be your driver and your pain meds, because you will take those previous to the procedure starting. Yep. So do we have any questions of any kind that we can think of?
Well, just to mention also, you have until the end of the week to book your treatment for the special. And then it has to be completed by December 31st. Okay, so before the end of the year. But again, that option 1, you get about $1,500 in value with that one. So that's what we recommend, and that's where we see the best results. So please drop your name, in the Q&A section, just drop your name, and we'll be reaching out to probably everyone, but those people will definitely.
If you want reached out to sooner, I know there's a couple people that had trouble logging on and they were pretty disappointed, so we're going to try to get that taken care of.
Okay, so I'm just looking through some of the questions here. Okay, so Ultherapy, maybe 25. We have a question that I had Ultherapy maybe 25 years ago. How is this different? Ultherapy's been out for 12 years. Okay, so if you're thinking of something 25 years ago, it might be something different, maybe similar in a sense, but like we said in the beginning, the protocol has come such a long way, and the technology has only improved. So if you had this 25 years ago,
it's very different.
You might not recognize it now because we've made a lot of improvements as a company on it. We've refined the protocols based off what we've learned from the market on it. and we've managed, we made it more comfortable for patients, and Jill's been working with this for 12 years, and just in the 12 years, like the protocols
It's
have changed a couple times.
I do attend those conferences regularly because I feel that if the company has one, they have new information to deliver and they want us to go over that and deliver it to the patients. You always learn something. So I think it's a big thing to go to.
Yep. And then here we have, is there any chance that this procedure could cause broken surface veins?
No, I've not had, no. We don't have it because there's no needles. We're not opening your skin. A bruise, but not an open, vein of bleeding or anything like that. No.
And just to reemphasize, we're not actually delivering the energy into the surface of the skin. It's actually bypassing the surface, and it's only where those ultrasound waves hit that we're delivering the energy. So it doesn't heat up any of the energy until we get to that specific depth that Jill chooses is the right depth for you based on where your collagen is.
And I'm looking at how much was number 2. I'd have to look at that again. I think it's lower faces around 27 to 29, depending on what areas we're going to do, which is typically, this back area is what we're going to sort of treat to release some of the extra tension that will come down this way. It'll also tighten under the chin. I believe that gave you free lines under the eyes, and we could also move it to around the mouth. Neck was going to be under your chin all the way down. And then you got the upper area free. So we can adjust it, it's not going to be a specific thing. As far as, I don't want somebody to feel left out if they just did it, want a less of an area. The biggest thing is if you're a new patient, you should really start with full face. Or if the top doesn't bother you at all, maybe you just have no hooding, your forehead is fantastic, you don't care. Then I would say do the bottom, the lower face option. That would be a good one for you to choose. And, we can, like I said, FaceTime. I think that would be easiest if you want to drive here and then drive back. It's an easy way to talk to. I have a lot of people out of town that drive from, far. It's kind of crazy, that want to come to our office. So it's fine for me to FaceTime if you're in Pennsylvania or below Columbus, things like that. We get a lot of people from out of town. And you will be able to drive yourself if you just use Pronox. It's very easy. You could shop and go on with your day. So we also have a makeup artist that can throw some makeup on you for free at the end if you are going somewhere with family or something. So
Jill, have you had this procedure?
I have. I've had it done several times. I really like it. I am someone who gets a little bit red. My dad is very light skinned, more red hair nationality. And so I do get pretty red and swollen. It's maybe a day. If I have any crazy reactions, it's usually on my neck. Even retin-A can cause a problem. That again would be a day or two. When I get my brows treated, I can sometimes feel it on the top of my head. Your nerves will travel across the top of your head. That's all very normal. I think that it gives a great boost to your Botox because it's your own tissue that's done so well. I'm 52. So I have had, that done, and I really, really like it a lot. I have done face, neck, and chest. So
now Jill's best patients are people that get it done once a year. And if their budget allows it, or even once every 2 years, just stay on a consistent regimen with it. A lot of times we take the before pictures. I can't even tell you how many times, I get sent these before pictures where patients had it done maybe 10 years, for the last 10 years. They've had 4 treatments in the last 10 years, once every 2 years or so, or even 5. They'll actually look better at their 10-year.
It does continue to build. I truly believe that. It really makes such a big difference if you continue with something like this. The other thing is some people like this as their only treatment. They're going to be someone who's going to be more natural. I do think blending the therapies really help. But you can choose this as your only one. And I do have people that say, like, I have gone to family reunions and you should see my sisters, whatever. And they're like, all right, you've held up so well. What have you done? And if you don't want to say anything, you really don't have to. You're just like, I guess my gene, I don't know, or you can be honest and tell. But there's been some private, conversations that people have had and said, I'm so thankful that I did this, and I'm like, that's really great. So a lot of why I believe in what I do and the things that I do it the way that I do are the people that return and thank me and things like that. So that's been really great.
Yeah, here, Jill will reach out to you guys. I see the question of the price for the 3 options.
Yes.
She'll reach out to you. She'll discuss the price, what's best for you.
Mm-hmm.
We have which clinic is Ultherapy performed? The one here
Beechwood.
in Beechwood?
Yes.
Okay.
If you want to talk to me, I am in Westlake 2 days a month with Dr. Parker for consults, but the treatments would be here.
And then for psoriasis, It's not an official contraindication for us, but we want to make sure that it's not flared up at the time. Maybe it's probably a good idea. But we'll consult some of the doctors here in the office on that skin condition, or on any skin conditions that you have for that matter, if there's any issues with that. But again, if that's a concern, we'll take it offline, because I told you 12:30, but I'm a liar, I guess. So.
Well, that's okay. I mean, if you need to sign off with the questions. The last one is how long does it last? So again, I really feel that they're buildable results. So meaning that, yes, you continue to age. I think a lot of that is menopause and different things like that with women. But when you're doing the treatment and you're continuing to tighten, people do continue to get better. So people that have said, gosh, I've done so much to hear up over the years, and I really haven't done as much to hear down. I'm maybe going to come back and retreat my neck a little faster than I'm going to my face. Those are all good options and things that you can do. I just don't think, like Cam said, you don't really want to just treat your cheeks if you're trying to, do some treating here. It really would be around the mouth, the eye, and even raising your brows does help to kind of lift the outer part of your face. So basically everything is really connected together, and to get all of your tissue working together is the best thing to do.
Yep. And
especially
so normally,
in the beginning. So.
Normally at 1.5 years the question came through, at 1.5 years, we start to see some of those signs, like slightly those signs of aging start to creep in again. Okay. So I compare it to getting your hair done. How often do you get your hair done? Well, some people just go back and get it done when they start to see their roots come in, or when they just can't take their roots showing anymore, or their split ends, they just can't take it. So whenever you think it's deemed like, okay, these signs of aging are starting to creep back in on my face, that's probably when you should get it done. Some people could go longer with it if they're okay with kind of going back to where they were before. But if we really want to build off the treatment and really start to really, have you build off your last treatment, a year to a year and a half is a great time to come in if your budget allows for it.
And a lot of people say that. They're like, okay, I just know that, around October is my year. So I start thinking I really should try to decide when I can see Jill. Do I want to do it before Christmas, after Christmas? And I will say that you probably you feel it in the beginning. You notice it in the beginning, like he said earlier, that is definitely swelling. So when some of that goes down and your body kind of starts regenerating the collagen, I'd say if you're a fast healer, you're going to start noticing it closer to 3 months. And then if you heal a little slower, it can be 6 to 8 months. Your body continues to change. So it really is something that is really good, long term. Oh, you will get the eye cream. I think what we'll end up probably doing is if you come in for the consult, you'll get it. I'll have Nina maybe answer some of that. I'm assuming they're going to send it. But yes, everyone that attended is going to get one. So that's definitely going to happen.
We have a registration list. So that's all going to, we have everything.
So we know who paid and all of that. So yep, that's already.
Yep. And then the last thing is, I just want to leave you guys with I'm a big believer in this. Again, like I said, I've done this for 2 years, inside, outside, every single day of my life. And my wife does it. My mom does it. My sister gets it done. And to be honest, I mean, hopefully there's no other practice that I work with, but I send them to Jill. Okay. So that's who I, my wife, I send her to Jill to get it done because of her experience, because of what you get with the Parker Clinic and the practice and the doctors, the access to all that stuff too. So, and then it's a no downtime procedure and it works. Okay. Yes. We're big believers in it. So if you have any concerns about aging, some of the signs of aging that we discussed, then you're a great candidate for this and you're in the right hands.
So I can't determine, I did get a question about the anesthesia. It's not really anesthesia. We don't do surgery on this site. So you would get a Demerol shot similar to when you were delivering a baby. Those are back in, they were out of stock for a long time. And you can, or we have a Valium and a Vicodin combo. Again, doctors will determine those things for you to make sure that any other medications you're taking would be okay. And then the other thing is the Pronox is not intravenous. It's a tube and it's a two-way valve. So you're breathing in and breathing back out through the tube. It's not a mask over your face like the dentist. The dentist is required to pump it out of the building, and ours actually goes to a hose on the floor and we monitor it, and it's completely safe. So full face is, like I said, between 3,200 and it's under your chin and up. Your neck is around 16. And then getting your chest free is around 11 or 1,200. Downtime needed between.
If there's any questions about like combining treatment, like if you have a certain skin condition, we'll definitely address that before your treatment. So no need to worry, but we don't have many contraindications. So
Right.
you're probably
Taking the daily aspirin is fine. I do as well. I have high blood pressure, so that's fine.
And then the big thing is all therapy doesn't take care of every single thing. So
right.
it's actually, we had the question, is there any downtime between laser treatments? If you get all therapy done first, then, and we don't break the surface of the skin, there's no blood, there's nothing like that,
right.
then lasers, you know, it's probably best to wait about 10 days just so that you're not delivering too much heat to the surface or to the skin. But we actually encourage getting lasers done for more like pore size issues or
right.
texture issues.
Things that are higher in the skin.
Correct.
Yep.
Yeah. So they're different layers of the skin. So great question, whoever sent that in. That was, you know, we love to combine it with other things just to give you like the full 360-degree treatment that we have here. I think that's it.
I think that is it. Any other questions we can think of? I'm going to go ahead and have them reach out to all of you. Thank you so much for tuning in and for watching our first Zoom. It's kind of exciting. We can reach more people this way. And, you know, we're always here to answer your questions. You can certainly see Dr. Parker or any of your physicians to find out if you think this is good for you. Thank you very much. That's kind. To just make sure that this is a good decision. But again, we don't really feel that this is a bad treatment for anybody. The great thing is you don't have to, you know, you can do it in the summer, you can do it when you're traveling. So if you miss out this round, it is still something that we really love and we do a lot of at the practice. So I hope all of you enjoy the rest of your day. And thank you.
And Jill or some of the girls will be reaching out to you guys. We have the numbers, so we'll be expect a call between now and our next session, maybe, or at another time. And or if not, feel free to call.
Yeah,
right?
You can call and just schedule too. Like I said, they'll schedule the FaceTime, or you can come in person if you want to consult. If you know you just want to do it, you can schedule about a 15-minute consultation with a treatment. So we can go over what you're going to do, and they'll pretty much know. If you know you're thinking you want full face, then they know the times that are allotted for each person and things like that. And I would say at the very least to book the Pronox with the treatment. It'll make everything very comfortable for you. So.
Yep.
Okay.
All right, guys. I think that's it.
Thank you.
Yep. And so I'll stop sharing the screen. But if you guys have any questions, we'll hang out for a little bit till everyone kind of logs off. But we'll talk to you guys soon.
Thank you.